Hi, I'm Brendan D'Souza, one of the analysts on Edison's TMT research team. Today, I'm joined by Baiju Thakkar, CEO of Dr. Anywhere, and Dan Curran, CFO. Welcome, gentlemen.
Thank you for having us, Brendan.
Pleasure is mine. Can I start by asking about your Q1 results? This showed that you've had a very robust start to 2021. Could you please provide us with an overview of both your financial and operational performance in the first quarter of this year?
Yeah, of course. We have had a very pleasing start to 21, and I'll ask Dan to take us through some of those highlights. But before we do, if I may, just a quick reminder of what Dr. Anywhere is doing and what it intends to do. So as you will know, we are a digital healthcare business that has built its own technology platform and hires its own clinicians to provide rapid access to high quality clinical care by video or phone from wherever you are in the world. And uniquely, we brought together that capability with diagnostics and with specialist care to provide a unique market joined up healthcare service in the cloud. And going forward, we're hugely excited about adding on to that to provide a unique digital health ecosystem that provides complete care, putting the patient at the center. And we're very excited about that. But I'll ask Dan to highlight our Q1 results.
Thanks, Baiju. So we're really pleased with our performance across Q1 of this year. To take you through some of the key metrics for the quarter, we generated 4.4 million of underlying revenue. This is the most revenue we've ever generated in a quarter, and it represents 17% growth above Q4 of last year. At the end of the quarter, 2.4 million people were eligible to access our service, and that's 7% growth above where we finished last year. 500,000 people had activated their accounts to use our service. That's 15% growth above where we ended last year. We delivered in excess of 90,000 GP consultations. That represents over 20% growth above where we finished above the prior quarter. But the thing that really stands out for me as the highlight for the quarter is the number of consultations we delivered in the month of March. In March, we delivered in excess of 34,000 consultations. That represents growth of 32% above the highest month in the prior quarter. And the reason that's really important for me is that it shows that not only did we grow quarter on quarter, but we sustained that growth throughout the quarter. And that fills me with confidence about our outlook for the remainder of the year.
Thank you, Dan. It has been a fantastic quarter. I would just like to add to that. Now, one of the real drivers of our growth, the real main drivers actually preceded COVID. The fact is, here in the UK, way before COVID came about, we had huge structural pressure, which meant waiting times for a GP appointment have been maybe 2, 3, and sometimes 4 weeks. And indeed, waiting times for diagnostics, many months at a time. These have only been made worse by COVID. And so demand for services like ours is only going to continue to increase because of those structural pressures. It's also worth noting that as lockdown eases, more diagnostic capability is going to come online, which will further help our growth trajectory over the months and years ahead.
Thank you, gents. Can you just talk us through your outlook for 2021, please?
Absolutely. Before I get into that, I'll just do a quick reminder of how we go to market and the size of the market. So we go to market through channel partners, such as large health insurers and large hospital groups. And the market that we go to through them is the UK private healthcare market. That is a market in which there are around 10 million people. Through our existing channel partners, we do have the ability to access about 4 million of them. We know that in a given year, on average, people have 3 GP consultations. We know that 2 of them can be delivered virtually. So we know that for those 4 million people having 2 consultations each, 8 million consultations a year. The minimum we charge for a GP consultation is £45. That's £360 million of revenue potential in our current market through the provision of our core virtual GP service alone. Our revenue last year was 11.6 million, which shows there is really substantial room for us to continue to grow within our existing market. And that's before we think about driving through more people to our diagnostic services. It's before we think about scaling up our mental health service, and it's before we even consider any international expansion. It's that very large home market in which we operate that gives me great confidence in the guidance that we issued with our quarterly results, which was that we expect to grow at least 100% top line in 2021 versus 2020.
After your Q1 results, you've had recently, you hosted your maiden AGM. Are there any developments at the AGM that you would like to highlight?
Thanks, Brendan. There are a few. I mean, first to say it was an absolute privilege to be able to conduct our first AGM, and it's been a delight to have had such a successful IPO on the ASX at the back end of last year, and I think the largest healthcare listing in that market. So we're hugely pleased and obviously humbled by the quality of our register that we were able to feed back to at the AGM. A few things for me. So one, as I've mentioned, we have built a unique proposition here in the UK of joining up primary care, diagnostics and specialist reviews. And now going forward, we want to provide complete care. That's adding on a totally holistic service around the patient to be there when they need us for more than just acute episodic care, but their mental health, their chronic disease and so on, and be able to really look after them and their families. And we're very excited about the future of being the first to build a true, complete digital health ecosystem. I think one of the second thing that we really pulled out in the AGM was around our international expansion. You will know we contracted with Allianz across Europe to serve European citizens through their IPMI book. And we also launched in the Republic of Ireland, where we're serving one of the UK's largest retail banks. That's a great foray into the international markets, and we expect to be doing a lot more of that in the future, given the growth in telehealth services and how well positioned we are to capture that market. And finally, I mentioned at the AGM that there is a huge amount of consolidation happening within this particular market, as you would expect, and we believe we're very well placed to be a consolidator, and as such are doing some significant investigation as to how that can become a strategic pillar of growth for us going forward. So lots of exciting things beyond just our Q1 results, looking forward to the future around becoming a complete healthcare system, expanding internationally, and being able to conduct M&A ahead of our competition.
Could you provide us with some color on your new and expanded partnership with Nuffield, please?
With Nuffield Health, which is one of the largest hospital groups across the UK. Yes, they've been a partner of ours for a number of years now, where we've been providing virtual GP services to their customer base. And now that partnership is being extended to provide, again, another market unique proposition of joined up virtual GP and in-person GP services together, which is just testament to our hypothesis that joining up clinical care is the way to win in this space and to deliver better clinical outcomes. So we're delighted to be doing that with Nuffield across the entire UK, a new unique proposition which will open up more of the market. So exciting times ahead, again, with that new channel partner.
Thank you so much, Baiju and Dan, for your time. We look forward to speaking to you in about 3 months' time, and thanks once again for your time.
Thanks, Brendan.
Thank you, Brendan.